Leanne. So it looks like we're interviewing you today. Thank you so much for being here.
You're welcome. I'm a bit nervous because the tables have turned.
Yes, it does feel weird to be on this side actually. So it's nice to have you in the other shoe there. So today we're going to be talking about cognitive assessments. So I guess if we just jump right into it, what is a cognitive assessment for families who may not know?
Yeah, it's a thing that is a really common assessment that we do here at Paeds in a pod. And often it's actually really common that parents don't know why they're there for it. And so I'll joke around that you say, why do you want one? And they'll say, I was just told to do it.
Yes,
and so I joke that, well, you're just following instructions. Nice to have you.
Yeah, exactly.
A cognitive assessment is an IQ test, basically. So people tend to know what an IQ test is more, but we call it a cognitive assessment. So it's about working out, I guess technically, intelligence levels or cognitive abilities. That means the same thing. It gives us an IQ score, which is an estimate of somebody's cognitive ability which is essentially problem-solving ability.
Yeah.
The cognitive assessments we use most often are the WISC, which is the Wechsler test. It's a bit too technical, but
yeah, that's
still.
Okay.
And so for younger kids, it's called the WIPSI. So there's kind of just a preschool version of the same kind of test.
So it's like age related.
Yeah, that's right. They try to adjust it so that the one for smaller kids involves less things like, less fine motor skills. So, for example, rather than use a pencil, kids are holding a stamp in their fist and just stamping. So they try to make sure that it's, age appropriate. So what an IQ test or cognitive assessment is a test of problem solving. It breaks it down then into different cognitive areas for families. So one area is verbal comprehension. So that's kind of problem solving that involves words. So things like vocabulary and using verbal concepts like how things are similar, being able to explain things like that. It also looks at visual spatial skills. So that's things that relate to like measurement or space. Those kind of concepts underlie things like maths. And fluid reasoning is the third area. Fluid reasoning looks at the ability to take all the knowledge and information we have already and apply it to a new problem. So things like recognising patterns and which pictures or shapes should fit in a certain grid. So that's an interesting concept because that's essentially what every test is at school. It's using what you know to solve a new problem that they've asked you on the test.
Yeah, I'm glad you went into a little bit more detail about the fluid reasoning because even for me, that's interesting and it's great to know because, I don't think that families would, primarily know that either.
Yeah.
So I guess if a child was coming ideally for a cognitive, who would have instigated that? Would it be a school or a GP or why would a child essentially then come here or how would they get here?
That's a good point and that's probably worth having talked about before. Usually it's when kids are having difficulty at school, if they're school age, that might be with learning, or when they're younger with difficulty developing as well. So whether that's at their communication and motor skills and social interactions or play are delayed. So where kids have delay in a few different areas is called global developmental delay. Yes. And so at that point we want to make sure, is this kind of a cognitive problem that kids have or are they just kind of taking a bit longer to develop?
Yeah, sure.
But then, at school, it's about if kids are having trouble meeting the standards at school and meeting the standard is getting C's in their achievement is when they might get a cognitive assessment. Cognitive assessments are really good at predicting how kids go at school. I always say that doesn't mean it predicts how they'll go in life. Yeah. But so the cognitive assessment gives us a guide as to whether kids should be achieving at that standard level of making a C each year, or it lets us know if there's if they have low cognitive abilities. It might mean that it takes them longer to learn. They need more repetition, and so they may have difficulty meeting the standards.
Yeah, certainly. And I guess that then goes into a little bit of the next question about how a cognitive assessment might help a child. So realistically, like school performance and stuff like that, touching a little bit on that and whatnot.
Yeah, so it gives a good, it's a really good guide and a way to set expectations for your kids. So all of us are on this kind of normal curve in terms of cognitive ability. So most of us are average. We might like to think we're above, but most of us
that makes me feel really good.
So some kids are, have high levels of ability, and so they learn quickly. Things come easily to them, and they can excel at school and at other things. Some kids have low ability, so where they're below the rest of their peers.
Yep.
And some have really significant difficulties, at which point we might talk about them having an intellectual impairment or something like that. So the cognitive assessment is really the first step at guiding our expectations about what ability a child has, so we know, we can work out whether they're achieving about where they should be given their ability, or whether there are other factors happening.
Yeah, certainly. Yeah. That's great. And I guess for families who then come to Paeds in a Pod for a cognitive assessment, like what is it that they could expect on the day, during that appointment? How long will it take? Things like that. So, maybe for those who might be feeling a little bit anxious in preparation for that cognitive assessment, can we maybe give them a bit of a breakdown of what to expect, so it just relieves a little bit of that, anxiety maybe around it?
Yeah, so that's one thing, is that we psychologists we always want to see a family and a child first as well.
Yeah, certainly. Initial appointment, really important.
Yeah, and the reason is so that we can, first of all, there's two main reasons. The first one is that we want to assess a whole range of things to make sure that the assessment it's the right time to do an assessment.
Correct.
So for that, it might be, we don't want to assess kids when they've just recently been through something difficult, like if they've had a traumatic experience, or if they've got some really heightened anxiety or depression or something like that. Yeah. Or if we want to make sure that they've got the, attentional side of things covered as well. Sorry, I've lost my train of thought. But so we want to make sure it's the right time to do the test. Yes. The second thing is we want to make sure the kids have the ability to do the test well.
Yeah.
So for that, we want to make sure that things like fine motor skills and that's all kind of in place. We don't want to do a test that's where we're asking a child to do something they physically aren't capable of doing, because certainly. Then we don't have the right, it's not going to be a valid result.
Yeah, certainly.
So the other thing is what you touched on about the so kids knowing what to expect and being calm for the assessment. It's really important that they get to know the context of the assessment, so why they're doing it and what information it's going to bring, because like anything, you or I would be the same. If someone says we're coming for a test, it heightens your kind of nerves.
Absolutely.
So if kids understand that it's about finding out what kind of things come easily to you and naturally to you, the things you're good at, and also knowing what things are harder for you and tricky.
Yeah.
I explain that it's about, if we understand how you think and solve problems, then your family and your teachers can help you in the right way.
Yeah, absolutely.
And so it also gives the opportunity for the child to meet the psychologist, and for the psychologist to meet the child as well. So that helps the kids come in knowing, and they've met the person before.
Not as daunting, and there's like rapport there, I guess, between practitioner and patient.
Yeah. And also from the psychology point of view, that if I've met a child, then I kind of know a bit about what they're interested in, and so I can bring certain stickers or toys or whatever that we can use as a reward.
Elements into the assessment almost, would you say?
Yeah, okay. That's right.
Really helpful.
And keep in mind too, if, this is a kid who might need to have more breaks than most, so we'll make sure we schedule enough time.
Yeah.
Yeah. So you did ask before about the time for the assessment.
Yes.
So usually we meet initially for an hour, and then I like to set aside 2 hours for the assessment, because sometimes it takes that long and other times it doesn't, but it allows for having breaks and for if a child gets anxious or nervous to problem solve that and reduces the pressure of time.
Absolutely. You don't want to have to be worrying about, the next, time bracket, I guess, or anything like so. Exactly. Allocating, enough time is, I think, really helpful for families as well as yourself and stuff like that, which is really good.
Yeah.
And I guess then about specific learning disorders and anything like that, can you touch base a little bit about that? Maybe give us some information?
Yeah. So the where kids have a specific learning disorder, that's where they have kind of most often have typical cognitive ability, so the IQ may be average or sometimes higher, but they have difficulty learning, which means they have difficulty meeting the standards at school. So the cognitive assessment is the first step in determining what is the right expectation for kids. And then if we find that they've got average abilities, but they're having difficulty learning, usually it's in a specific area, so like in reading or in writing or in mathematics. Then we do an achievement test, which is the next step in identifying that.
Yeah.
The achievement test is more similar to the tests they do at school. So it's tests of reading single words, reading comprehension, spelling, writing sentences, and then also doing math problems as well. So this one is not as enjoyable for the
So would you say that's a little bit like NAPLAN or?
Yeah, it's pretty similar to NAPLAN. And so the reason that we do this additional test above and beyond what school do is that it's by the same company, so it's a Wechsler test as well, and it allows us to statistically look at the difference between the cognitive ability and then the achievement. So where there's a big difference and the achievement is much lower than the cognitive ability, and usually the achievement is also lower than the average for that school grade, that's when we can identify there's a specific learning difficulty there.
Okay, yeah, I think that's great information. And is there anything else that you think that we should, maybe pass on to families? First and foremost, like definitely, don't be anxious about it. It's something that's quite common too. Like, it's not like, something that's unheard of or anything like that. Yeah, so no need to feel like pressure or anything like that. We're here to help the best we can. And, certainly if you had any questions prior, we can, you can direct those to reception. And if, we're not sure, we can then ask you so that we can provide that information back to families to help them. But anything else that you think that we need to touch on, do you think, for families? Or
There's a couple of things that have come up as I was talking. One of them I think is that, you're right. I talk about how it's not a thing to be nervous about. It's a thing because, most times when kids are at school, they already know it's hard for them.
Yeah.
And so I explain it that, it's just about helping find different ways that you learn to make school easier for you.
We're not all the same.
Yeah, exactly. And I see you've got glasses on today, Tori. I explain it to kids about how if somebody can't see well, then we give them glasses so that they can see well and keep doing their job. So when you can't when you can't learn well, if there's other things we can do to make it easier for you, different ways that you can, so for example, it might be if reading is difficult, that then that rather than give you the worksheet, the teachers also tell you verbally the instruction. That's kind of the support that's similar to glasses, and it can help you do the rest of your work well. Then, shouldn't we be doing that for
like
kids?
Tools.
Yeah,
providing tools for them and stuff like that.
I wouldn't expect people who can't see to go about their day without glasses. So why do we, the kids shouldn't feel like they should be able to go through school without these other supports.
Absolutely. Yeah, really helpful. So that's fantastic. Thank you so much for that.
Yeah.
I think that maybe all, or do you have something else?
The one last thing is because I was thinking about how I talked initially about seeing a psychologist can help us work out the right test to use and that kind of thing. And so sometimes there are different tests that we can do for example, kids who might have big language problems or where children have autism spectrum disorder. there's non-verbal versions of
fantastic.
cognitive tests as well, so that we can really get a sense of their problem-solving ability without the difficulty of language affecting the results.
Oh, that's excellent.
Yeah, so that's another reason we want to meet the children first and gather all that other information. And
yeah, that's really helpful. Thank you so much. And I'm sure the families will find that helpful as well, and informative, because that's really what we want to help as well, and everything like that.
Exactly.
So, yeah, that's really great. I feel like I've learned some stuff about cognitive assessments today. And,
that's good.
Yeah.
We've got some fact sheets as well for families, because it's a lot to take in. So some fact sheets about the tests themselves and the process of it as well.
Yeah.
So that then they can refer back to that.
Absolutely.
Yeah.
And if a family has an appointment booked, reception would normally email them with all their appointment information, and, you know, they can have those assessment fact sheets attached there and stuff. But I guess for families, you know, who might not necessarily have an appointment yet, you know, they could even phone us and ask, and, you know, we'd be happy to forward those fact sheets to them as well, just so they can have a read before booking, I guess, as well.
Yep, definitely. I've had that. I've done that a few times, or I've talked to families on the phone too, because they don't quite understand it, and they don't want to know that. Sorry, they want to know how it's all going to fit.
Yes.
And our team here too talk about it amongst ourselves as to which kind of thing we think would fit or work with each child. So I've had a few who I've talked to because they've seen one of our other psychologists who then has asked them to come over to see me. So we're really happy to help.
Yeah, absolutely.
Yeah.
Perfect. Well, that's great. Thank you so much for being here today.
You're welcome.
Excellent. Well, I'm sure we'll talk again, but you'll be in the other position.
Yes,
doing all the questions. Yeah, fantastic. Lovely. Well, you have a great day.
Thank you.
No
You too.
problems.